Hello, I'm Dr. Kermit Muhammad at OAK Orthopedics in Bradley, Illinois. I'm a hand and upper extremity specialist, and I wanted to discuss some issues with you today regarding pediatric wrist fractures. These are wrist fractures seen in young people, and of course I see them all the time. Of course, this does translate to other fractures, but today we're going to focus on the wrist. So one of the first questions I get is regarding what is a fracture. And of course, that can mean different things to different people. A fracture is a broken bone. A broken bone means that there's some discontinuity in the bone surface and that there's actually a break. And we can see this usually on x-ray, sometimes MRI. A break is the same as a fracture, but of course there can be many different severities. And regarding the wrist, in children, there's really a grade from really not too bad to really severe and needing surgery. So here's a model of the wrist and hand, and in general when we're talking about wrist fractures in adults and children, we're usually talking about the radius, which is this bone. This is on the thumb side or the radial side, and the ulna, which is on the ulnar side or the outside of the hand or the side where the pinky is. So there are also 8 smaller bones in the wrist. And these can be included in that. However, in general, when we're referring to wrist fractures, we're talking about these 2 bones. If we're saying that there's a torus fracture or a green stick fracture, we're saying that in the child the bone is bent. And this is one of the characteristics of fractures in children, where the actual cortex or the outside of the bone doesn't have to be broken, but it can be bent, in which case it needs to be set. It can also be completely snapped apart like a dry branch as well. These are common types of fractures that we see in children. There are many questions from parents regarding which fractures need surgery and which ones don't, and understanding why, and I think that's important to explain to you. So many fractures, as I mentioned, may be bent in a child. They may be completely displaced or separated and require that we reduce the bone or set the bone in place. Oftentimes this requires anesthesia, which is surgery. So it is a surgical procedure where we straighten the bone and set the bone. In addition, many times we may set the bone and then put a pin or a screw across that bone. And that is surgery in terms of making an incision. So that's the basic reason why we would have to take someone to surgery. So assuming that we're treating this fracture non-operatively or it's healing, we have the option of a cast, a splint, or a removable brace. And the question is, what is the difference between these? Very often, a removable brace can perform the function exactly as that of a cast, except it's much more convenient, easier for bathing, just easier to care for. So the bottom line is, if I can use a removable brace for a particular fracture, that is definitely my preference, and definitely patients and parents appreciate it. This is an example of a removable brace that we use for a wrist fracture. We have different types and different colors, but the advantage of this is that it can be locked in place and unlocked so that the child can bathe the extremity, but it's also sturdy enough to act just as a cast would act. So very often when we have a stable injury, we like to use this. Also, another question, we do have to use a cast still. So definitely a plaster cast is required in many cases. And one of the questions that comes about is what to do when the cast gets wet. And very often, it depends on how wet that is. Ultimately, if it's possible to dry the edges or use a hair dryer, we can try that, but usually what happens is you have to call the office and we have to direct you as to whether or not we need to change the cast. So the answer to that question is really, you need to contact us and kind of let us know what's happening, and so we can take care of the problem. So we've discussed setting the bones and making things straight, possibly taking the surgery and pinning. But one other question that comes up is, even after we've done these things and set the bone in place, sometimes there's still a little crookedness to the bone. And the question is sometimes, why is that, and what can be done about it, and why do we treat these fractures in that manner? And the important part to realize for pediatric fractures is that there's a lot of remodeling. In other words, the bones magically tend to straighten by themselves as a child is growing. So when we set the bone in place, we try to get it as good as possible, but not as perfect as we might need to get it with an adult. So there are those times where either maybe the child is presenting late and the fracture's already started to heal, or for whatever reason the bone could not be completely straightened, and we allow this to straighten up over time, and sometimes that can take up to a year. Ultimately, your surgeon will know by following the x-rays whether or not this is a problem. So that's an important aspect to consider in fractures in children. Another question that comes up is, when can my child resume sports after a fracture? And of course that does depend on the sport, and of course the severity of the fracture and what type of recovery is needed. However, in general, it takes 4 to 6 weeks for a fracture to heal. So that is the time range for return to certain sports, so probably 4 to 6 weeks. However, if therapy or strengthening is needed after that time, it may delay it a little bit longer. So it does vary, but 6 weeks is generally the higher end of what it takes for a fracture to heal. Another question that I get very often is, why is this particular fracture taking a long time to heal? In some cases, the fractures don't heal in this normal 4 to 6 week time frame. It sometimes can take much longer. And so the question is, why is that? And there can be a lot of different factors as to why that can occur, but currently the biggest reason is deficiency in vitamin D and calcium. In general, children don't drink milk as much as they used to, and some don't drink it at all, so there has to be some type of supplementation. So usually my advice at this time, if that does occur, is that we try to speed things up by making sure the child has enough calcium. So over-the-counter supplements of calcium and vitamin D are usually what are prescribed to help that problem. So another question that comes up is, will my child need therapy after this fracture is healed? And I would say that for the most part the answer is no. Generally in children, just allowing them to return to their play activities is enough. They're young, they're growing, their joints are very mobile, and they just tend not to get as stiff as adults. And so really just allowing them to play, they'll be able to work it out. So that generally will take care of it. Of course, there are definitely some times where we do send children to therapy for more severe injuries. So that covers what we wanted to discuss today about pediatric wrist fractures and some general concepts of children's fractures. If you have any questions regarding this, or have a child that needs care for a fracture, please do not hesitate to call us at our main office number, 815-928-8050, or visit us on the web, and you can see the different areas of orthopedics that we cover. Our web address is oakortho.com.